Hello, my name is Bisi. I'm here with Sharon today to examine her knee. Sharon is a 25-year-old female professional basketballer. She's been playing for 6 years. She had an accident 2 years ago where she fell off a motorbike and the motorbike landed on her knee. There was a first valgus and flexion biomechanic of injury at the time, and there was gross swelling and pain. Sharon did not get immediate medical help at that time. She got an alternative medicine, so alternative care then, and it was a lot of massaging and a lot of mobilization, which did not help her case. After the incident, she found out that she couldn't run anymore, she couldn't walk for prolonged distances, and she couldn't squat. So she had to stay off basketball for a year. Now, after this year, she came to the sports medicine center to get proper care. She saw a doctor and she was referred here. When she came in with knee pain. It was gross swelling, there was gross atrophy of the vastus medialis, and instability, loss of function. She came in limping, though she didn't have any assistive devices. She came in limping and with a fusion in the knee. On examination, she had pain on active flexion. I want you to flex your knee. Flex all the way, as far as you can go. Any pain? Straight. She had pain on active flexion and on passive flexion. There was apprehension going to the end of the range, and at the end of the range there's a firm end feel at the end of the range. With taking the knee into hyperextension. Any pain?
Yeah.
She has pain on hyperextension, which could be anterior cruciate ligamentous, could be a meniscal lesion, could be the tendon. A number of things could be going on in there. And when I take the knee into flexion and palpate the joint line, I'm going to do that in 2 stages. I'm going to do it with a bit of flexion. Okay. In the joint line tenderness, medially, and joint line tenderness laterally. Now going further into extension, I'm going to repeat it. Medial and laterally. Now, a number of things could be going on in there. We could have the anterior cruciate ligament, we could have the medial meniscus, we could have the lateral meniscus, we could have the medial collateral ligament, or the lateral. So I'm going to start by doing the valgus test to test the medial collateral ligament. Relax. I'm going to put our knee into valgus stress test. You can see the gaping. You zoom in. Of the middle. Now I'm going to go further in by taking it. There's instability and gaping of the medial collateral ligament, and I'm going to do the varus. Relax. Any pain? Medially or laterally?
It's okay.
Okay, that could be the lateral meniscus or the lateral collateral ligament, but there's definitely a medial collateral ligament strain because the valgus stress test was positive. Now I'm going to do the anterior cruciate ligaments test, which I'm going to do the anterior draws test. And I want you to zoom in. See the displacement of the tibia on the fibula. That shows the sprain of the anterior cruciate. That is significant compared to the other side, which did not show as much gaping. And then I'll go in and do the Lackmans to confirm this further.
You can see the gaping.
That is also significant compared to the left side, and this shows that she definitely has an anterior cruciate ligament sprain. So we've done tests to show that she has the medial collateral ligament sprain, she has the anterior cruciate ligament sprain, and the last thing I'm going to do is test the meniscus. So I'm going to do the McMurray's. And
Feel the click.
medially, laterally.
Do it again.
This shows that she has meniscal lesion, and I'm looking at both medial and lateral meniscal lesion. And at this point, the next thing to do is to do further investigation. We can do a diagnostic test, we can do an MRI, and this would show everything. But in this part of the world, MRI is very expensive. She might not be able to afford it. Health insurance for her might not approve it, but we'll do the best we can. If this can be done now, waiting for the MRI to be done, we can start conservative treatment by strengthening all the muscles around the knee to support it more, to give it more stability. The quadriceps, the hamstrings, the gastrocnemius, the anterior tibialis, can strengthen all those muscles, the popliteus at the back, can strengthen all those muscles, VMO, to increase stability. Now I want to do one more thing, the functional test. I want her to do some squatting to show the instability in the left knee. Now I want you to yes, yes. Up. Again. Up. Again. Good. Then stay. Now I want you to squat and stay. Okay.
Yeah.
You can see there's tremor, there's instability, and the knee is giving way medially. The knee is giving way medially, which shows there's instability and proves all the positive tests that we've gotten so far. You can have a seat. Okay. Yes, this shows again. You can see how it gives way medially. Comparing with the other leg, see how steady that leg is. So we start conservative treatment. You can see that. Conservative treatment for her. Strengthening the muscles around, treating the knee. We're going to use cryotherapy, we'll use thermotherapy, we'll use a lot of exercise, prescription, and then start rehabilitation. But we still would go on with the MRI and a possible ACL reconstruction and meniscus reconstruction. Thank you.